Hello everyone. Today we have chosen a topic considered to be very cautious by many, even to spell the word. But being a mental health professional, I felt that it's important I need to address this topic. So the topic of the day is understanding grief and death. So the topic of death is as complex and diverse as living itself. So when the news of death of our loved ones reaches us, we are all affected emotionally, maybe varying degrees, but there's no one who can escape from the hardship or the blow of hearing or the death itself. So we focus a little bit on the scientific perspective of what the literature says, what the research says, and we'll work mainly through the process of helping a child, especially in the family, seeing all the process or involved in the death and how parents feel when they lose a child, and then finally we'll close the topic by discussing briefly on how spirituality can help one handle the death. So looking at the theoretical or research aspects of what is being told in the theory part. So there's this psychiatrist Elizabeth Kubler-Ross that most of us are aware of when it comes to dealing with death or stages of death. Most of the common persons also are aware of this. I briefly describe that and then move on towards the other aspects. So this particular psychiatrist around 1970s has developed a theory by long-term research on terminally ill cancer patients. So, and come up with a theory of 5 stages. So when we look at this particular topic, grief and dying, there are 2 components that we need to keep in mind. One is about the person who is terminally ill, moving towards death, like in final stage of cancer, and the other person, the survivor, the grief of the survivor is the other component. So these stages apply to both of them. May not be in the same order that I am describing here, but these are the proposed stages that one go through when they hear the news of death or when they are themselves approaching death. So the first aspect is the shock and denial. So it is something that we all want to comfortably deny that it's far away or it's not me. So the shock and death, shock of hearing the news of death or moving the diagnosis that one is terminally ill and moving towards death and there's only a short period of being alive. The shock and denial is the first step or the first stage where the person becomes emotionally freezed and unwilling to believe it as so. So that is the first step, shock and denial. The second step, slowly moving towards anger, that why me, why it is me. You know, anger can be on the treating professionals, or anger can be on God, or anger can be towards a parent or family member. So this anger is where the person moves on and slowly the person starts moving towards bargaining. So is there a way that this can be reversed, or whether the diagnosis is correct, or shall I try some other doctor? Kind of the bargaining process that happens, and slowly one moves towards depression, that slowly the reality starts sinking in, and then the person starts showing symptoms of depression, being helpless, hopeless, mainly affecting the biological system, sleep and hunger, and slowly the final stage of accepting that it is the reality, and then coming to terms with that. So it can happen either coming to terms with that in a negative sense, or more in terms of looking at it like trying to fulfill the wishes, or completing one's duties, more towards integration or more towards construction. So these are the 5 stages that Kubler-Ross has been given long ago. So we'll look at, as a next step, what are the normal grief reactions? Is it immediately necessary that one has to take professional help when there is a death in the family, or a terminal illness has been diagnosed? Not necessary. So grief reactions can be normal, absolutely normal, and the person either moving towards the death, or the person who has lost someone loved do go through these normal grief reactions of being depressed and withdrawn, and like the stages that we have described may not be in the same order, but we all go through. No one is exceptional here. So the grief reactions are more or less going through the depression, or withdrawn, or denial, and feelings of anger, especially if if there is guilt associated with the person with whom that there is some strained relationship before the death. So the guilt can be something that can be much more stressful for the surviving person. So as long as the person is able to move on from this period of grief, usually settles over a period of 1 full-length calendar year, we consider it as normal, and then the rituals and the pilgrimage, or the usual social mourning process that happens over the period of time after the death can all be of some help in healing the survivors. So there are some important things that I wanted to bring shed light on here about the mourning as well as the grief. So when we say grief, it is mainly the psychological and the physiological reactions of the person going through the illness, or the person who lost someone. Whereas the mourning is more to do with the kind of belief systems, the rituals and the customs that are followed by a particular community, the family or the community. So some encourage expression through crying and all, some look at it more a silent process. It all depends on how they have tuned according to the customs and community. So more to do with the mourning process. So this is about the normal grief, but the focus is mainly on the pathological grief, where the grief becomes a little more, whatever the reactions of the grief becomes a little more prolonged or exaggerated or not resolved. That's when the person needs help, a little bit of help, where the strained emotions or the feelings, especially the negative emotions of depression and anger, needs an outlet or an expression. So here is where the person need to look for some help from the professional. So here they are mainly the same reactions as in grief, but they are prolonged or exaggerated or continued for a longer period. So let us say if the person is after weeks of the news still unable to accept or still able to deny, still in the process of denial of the death news, then there is a need. Or if the person is wanting to expressing feelings of wanting to join the dead person, which can happen when the person is sharing a close emotional relationship, and if the person has some active suicidal ideas or expressed or attempted, one need to immediately respond to this and then take some help towards moving on with the process. So there is some connection between phobia and pathological grieving. So a person, like in previous chapters we have discussed on phobias and fears, when it came to anxiety disorders, a person who is a phobic generally try to avoid the situations, which usually happens in pathological grieving as well. The person who is by nature or by tendency is a phobic or a fearful person. So this fear of being abandoned or fear of being left alone, the same way how a phobic person also behave, they try to avoid the places, or they try to avoid attending the rituals, or they try to avoid touching the belongings of the person. So one need to also understand that the grief need to be worked through. There is no escape. The more one stops grieving, or one arrests the grieving process, it some way comes out, and the process can be, or moving from there can be difficult. So grieving is, however painful it is, it's important that one has to move on from this grief. So some people try to shield or cover the news, or not let the person who is closely attached to the dead person by not giving the information or giving the information slowly. All this can only delay and make the grief much more complex than helping the person going through the normal process of grief. So hiding information or trying to avoid or escape, like in phobic person, pathological grieving can also become a complex process. So hence it is advised that the person who is especially attached closely need to know about the news at the earliest in order to move on from that towards a normal process of integration and acceptance. So this is about the pathological grieving. Let's put a little focus on how children respond to death in a family. So it all depends again on the age of the child, and also the relation that the child shares with the dead person. If the dead person is someone with whom the child shares a relation on a daily basis, the effect is different. If the person is a sibling or a parent, the effect is much more intense. So for children, the expression is much more in terms of behavior rather than in terms of expressing feelings. So here the person, the child, based on their age, if even as young as infants. So there can be effect on as young as infants, where there can be change of routine, and then the persons around the infant, the kind of environment the child is kept, all this can affect the infant. Generally a generally a toddler or someone who is between the age of 1 to 4 years, they usually think that death is reversible and the dead person might become alive. Generally, older kids between 5 to 9 years understand that the person cannot see or eat, or there is a reason for death, and then they also understand that the person is not going to come back, and they cannot see the person. Teenagers generally are more adult-like, and then they understand the reactions, but again they have difficulty in expressing their feelings. This is how the children generally respond. So what is more important here that need help is when children are trying to imitate the dead person, or trying to talk that they want to go and join the dead person, or they are unable to do their routine and unable to sleep, or there is a effect on their school performance, or refusing to go to school. Especially children, young children generally have this fear of losing the close person, especially if the person is a parent, or there can be reactions that the child can express, and most of them are delayed. They may not be expressing it continuously. Suddenly they might start behaving very normal as if everything is going on well, and suddenly they might show these signs of anxiety. There can be bedwetting, or there can be emotionally, the person, child might become more irritable and showing restlessness, throwing tantrums. Based on the age, the child might show the reactions. So if you feel that as a parent or as a family member, it's becoming difficult for you to handle this, and the child is getting affected, it's important that you look for professional help at the earliest. So that is the about how children are affected, and how parents are affected when they lose the child. So this is much more intense compared to the previous aspect that we have discussed just before. So this is something much more emotionally traumatic and can last for a lifetime in spite of active professional support. So especially if the child is an infant or a malformed baby, where and if there is any underlying marital disharmony between the couple, it can actually exacerbate or aggravate the situation, and a lot of blame and guilt, or unable to help the child, feeling helpless and anger. These are the feelings that the parent goes through, and it's important that persons dealing or persons trying to care for them be more empathetic to these feelings, and their anger is much more to do with their helplessness rather than they wanting to show anger on someone else. So looking at how a parent responds to the child's loss, now we will move on more towards what we can do as a management from a psychological perspective, how a professional can help a person going through that. So as I said, in the management, if it is a normal process of grieving, it is more to do with the time that over a period of time the person will be able to move on from this grieving stage and get back to the normal routine. But if it is turning out to be a pathological grieving where the depression is not settling and it's moving more towards a kind of self-harm or more towards unable to get back to the routine or withdrawing from social life, counseling is very, very important, and one need to look for help. So here mainly the expression of the emotions around the person, or sometimes like if they have shared a very negative relationship with the dead person, a lot of guilt or a lot of feelings, troubled feelings of anger and frustration, which is considered to be normal, need an outlet in order to work through this grieving process. So it's important that the counselor reassures, and that's what the role is supposed to be. And every person may not be very comfortable in this particular aspect, so it needs some amount of expertise in dealing with this particular area. So helping the person move on from the phases is what mainly work through in the counseling process. Like I said, children need to be actively observed for any signs of unable to handle the grief, and then need to be immediately look for some professional help. So coming to the important other possibility of the role of spirituality. So looking at the role of spirituality in dealing with the dead. So research has been coming up more and more towards how spirituality is helping one to deal with this impermanency or incompleteness that we all go through. So primarily we develop these attachments, and we try to kind of collect a lot of material comforts or all this towards a completeness, or thinking that attachment to the person or the material will help us to fulfill or able to handle our life happily. But when you lose this attachment person, or sometimes it can be a kind of blow to your self-esteem, dreams shattered or plans left half the way. So whatever the meaning that it comes with, so spirituality is something that can bring in some solace, attachment towards something more long-term, something more permanent, can be of much more helpful in bringing some amount of peace and coming to terms with the reality. So here I want to quote a little bit of some spiritual kind of words, especially that I found can be helpful to all of you. So this is a small paragraph that I am reading from Sri Sharada Devi and her Divine Play, written by Swami Chetanananda of Ramakrishna Mission. So everything is illusory, husband, wife, even this body. These are the great shackles of Maya. Unless you can free yourself from these shackles, you will never be able to cross to the other shore. Attachment to the body, this identification of the self with the body, must go. What is this body after all? It is nothing but 3 pounds of ashes when it is cremated. However strong or beautiful this body may be, it ends up in those 3 pounds of ashes, yet people are attached to it. What Maya? And she also talks about how householders or can handle these kind of feelings. If you love a human being, you will have to suffer for it. He or she is blessed indeed who can love God alone. There is no suffering in loving God. be devoted to God and take shelter at His feet. It is enough to remember that there is someone, call him father or mother or teacher, who is always protecting you. So these are some of the words that can bring in some understanding of how spirituality can help one to, accept the death. And not the least, but as being a psychologist, there is some important aspects that I want to throw light on, where when you are helping a person going through the grief, or when you see the grieving, if you can be a little kind to them and not getting into unnecessary arguments or blaming, it can help the other person to go through the process better. And especially when you are sharing a strained relation with a dead person, it's important that you have to understand that the relation has come to terms with, at least in this life, and no more blame or nothing is going to bring back the person. And it's important that you need to move on from this phase and see that how you can get back to the normal, back to the normal living, and hurt not, and then be kind is the message that I want to bring in here. Thank you all.